thank you both for joining this. I mean, taking time out of your busy day. I know it's been a crazy, six weeks now that we're going on. But I'm really happy to be joined by Peter and Natalee of UConn Health. And Peter, where are you guys at now? What's going on, right now with the COVID-19 response, and how is your and your team adapting to this crazy environment we're in?
Yeah, so great question. I'd start by saying team right now is most important. So we've devoted a lot of time and resources to connecting like this virtually, checking in on each other, in some cases reassigning work that can't be done virtually, and picking up work in the COVID-19 space that can. But we've, for the better part of 6 weeks, been really focused on COVID-19 and our response, our prospects and donors, community members, internal and external partners, developing messaging around that, creating constituency groups that we can approach for gifts at all levels, working with the UConn Health Board, leadership at UConn Health, as well as at the UConn Foundation, where Natalee and I both work. And the need here is much like it is elsewhere: protective equipment, supplies, as well as donations of food and charitable gifts too. And we've moved not away from that, but added to that, trying to raise funds for temporary housing for frontline workers that choose not to go home for fear of infecting family members, as well as childcare, and also having a pool of unrestricted funds, if you will, in COVID-19, so that the leadership of the hospital can rapidly respond to things that evolve on the ground as we continue to move through this until its ultimate conclusion.
Yeah, I mean, because so much of this is so unpredictable. And, right before we hit record, you mentioned that you are currently looking for RVs to house healthcare workers. Is that something you ever thought that you would be doing?
No, not at all. It's only about 4 hours old, but apparently it's a thing that's happening, and a good thing, across the country, where RV owners are donating them so that frontline healthcare workers, rather than going to a hotel, can go to their driveway and still keep appropriate distance from their family, but able to see them and just feel like they are away from work, but not in a hotel room in between shifts and in between days.
Yeah. So, I mean, let's be honest, you guys are in the Northeast. So for all the folks watching, if you're in the area, you are not using your RV right now. It is way too cold. We're due for 3 to 5 inches of snow tomorrow. So you can contact Peter and Natalee and give your recreational vehicle to the front lines for the next few weeks. Natalee, I mean, your job, so both of your jobs have completely, flipped upside down, but you were just sharing some of the work you're doing now on the stewardship level and gathering stories from donors and sharing those throughout UConn Health and with the UConn Foundation. Can you talk a little bit about the work you're doing on that end?
Sure. So we're really using this time to be, like you said, to steward our donors as much as we can. We haven't been able to do personal visits, obviously, so being able to connect with them virtually has been the best way for us to continue to stay in touch with them. And we're just checking in. We want to make sure that everybody's doing okay. So we're not asking for money. We're not checking on any of them in that way, but just a simple FaceTime call or an email or a phone call just to see how they're doing, mentally too, with everything that we have going on. And then on top of that, we have, as Peter mentioned, we have our COVID-19 Rapid Response Fund. And we're being extra diligent with those donors to really thank them more than just the email that they get, right after make their gift online. So I've created this so that they're getting some updates at the same time from our CEO, and then also asking them to share a message of hope or thanks that they'd like us to share with back to our frontline clinicians. So we're compiling. We've gotten some videos and some really beautiful pictures of even little kids holding up a sign that says thank you, and some beautiful messages that are being shared all the way up to the CEO of the hospital and then down to everybody in the hospital, which has been just really heartwarming.
Yeah, I think this is a time where it's more important than ever to put those faces to whether it's the person giving the support, whether it's the donor, giving to the institution, out of gratitude, grateful patients, or
Right.
it's the people who are impacted, the healthcare workers, who need that support as well when the solicitations happen, because we're people
Right.
raising money to protect other people.
Exactly. And that has been more evident in the last 6 weeks than ever before. And it's been really wonderful as our health sciences team to really, switch our focus pretty seamlessly. As soon as we were all sent home on March 13th, it was like, all right, well, we have a hospital to support now. And let's put scholarships aside for a minute and let's really focus on what's most important. And what's really nice is that the community has really come together in such a beautiful way. Folks that really don't have any other connection to UConn except maybe they were a patient or maybe they live in the town where our hospital is, are making gifts and showing their support, and it's really heartwarming.
Oh, it's awesome. There's a ray of sunshine in a dark time for our
Exactly.
country. Yeah.
Yes.
In preparation for this, we were talking a little bit, and Peter, you can kind of address this, but um, lots of challenges that have come up all of a sudden, and unexpectedly in the last few weeks. But then there's also been really great opportunities for you guys as the health fundraising arm of the UConn Foundation to work more closely with UConn Health and the leadership there, communications
Mhm.
teams there, as well as potentially the UConn Foundation overall for all of their major gift officers. And so, can you talk a little bit about those partnerships and what you're envisioning the next few weeks might look like?
Yeah, sure. So we, as Natalie said, are in the middle of this, and we have outstanding colleagues at the foundation, outstanding colleagues at UConn Health, and our goal as a team early on was to be sure that we could do everything possible to help UConn Health, the patients, the caregivers, the employees, wherever they are across the spectrum of UConn Health. Everyone there who shows up every day is dealing with this. And so, as Natalie alluded to, this has been our focus. We've kind of put some other things on the sideline. And what's been interesting is that we typically occupy this space and fundraise in this space, while our foundation colleagues will be fundraising for other schools and units and university priorities, all of which are incredibly important. But in this day and age, because COVID-19 is affecting everyone, we feel there's an opportunity for us to partner with our foundation colleagues because their donors and prospects and alumni are being affected by this. It's on their minds, it's in their community. And so we want to be able to aggregate all of the news and information and data and stats at UConn Health in this space so that they can use it alongside what they'll surely be telling alumni and donors about what's happening on the university main campus as well, which is tons and tons of great stuff. Talking about healthcare, talking about medicine, patients' care, clinical activity is new for a lot of them. And so Natalie has taken the lead on drafting some communication tips for them to make this easier to talk about. And we look forward to learning more from them and the university too about what's happening so we can share that news. We work more in a kind of community-based constituency, our catchment area and patient population around the hospital, as well as with alumni. And so we feel we're going to do quite well with our communication strategy and getting support from people. And our other goal too was to be sure that hospital leadership and frankly everyone at the hospital knew that the foundation was standing up a robust fundraising effort to help them, to help patients. And I'm on weekly calls with the senior executive leadership team of the hospital and daily communication with members of it, hearing from them, sharing information with them. So when this is all said and done, I think that we'll have really elevated our role and ourselves and our
Mhm.
profession in the healthcare space at UConn Health, and that we will emerge in a much stronger space, just having had to go through this terrible time.
Yeah, I mean, it is a terrible time, but it's also an opportunity to put into practice all of the professional skills that you, Natalee, and the team, have amassed in your careers. This is a time to really, show that the value of fundraising, the importance of this profession, because what we do impacts lives, saves lives. You just, right
Yeah.
before we started recording, you shared that the first patient treated, at UConn UConn Health has been released. And that's awesome. That's a person's life who is saved and will never be the same because of the work that you help support. So, thank you very much for that.
Oh, you're gonna make me cry, Mike.
I don't mean to. But it's true. It's true. Like this is a really, really critical time, and we're privileged to be partnering with you all and organizations like you that are supporting students, that are supporting healthcare workers, and that are literally saving lives. Sometimes on the advancement side, you say, oh well, we're not saving lives, but you guys are. So we're proud of that.
Another thing is a shout out to my foundation
To give that information. Yeah.
They have many of them checking in with us frequently, personally. How are you doing? How are things there? Because we have a geographical distance campuses. How can we help? It's just been really, really, really great. And I think as a foundation has brought us even closer together.
No, that's awesome. You have a great team in Stores and in Farmington and, across the state and across the region. I know you have folks up in Boston too.
Yeah.
But we're an awesome team and we love working with you. I'm going to ask you both this, but Natalee, since, Peter put you on the spot, you're developing some materials and things like that. UConn is not the only organization that is trying to train fundraisers how to raise money for new subjects like health centers, like the health sciences, at this time. So how are you educating, the rest of the foundation, and what resources are you putting in place to help other frontline fundraisers who aren't used to doing this, maybe raising money for sports, raising money for scholarships, transition in this topsy-turvy time?
Sure. I mean, it's a whole, really, like you said, it's a whole new ballgame for most of our colleagues that, we're trying hard as much as we can to educate them on not just what COVID-19 is doing to, or how our hospital is adapting to it, but what our hospital is also doing to support its employees, where that money is going that they're going to be asking their donors for. So we are on twice a week calls, town halls with our CEO. So we're really privy to information that isn't necessarily out there for everybody to know. So we're trying to make sure that we get that out to the rest of our colleagues. So things like daily meditations that the hospital started for all doctors and nurses or anybody that wants to take advantage of it. And telehealth, online free therapy sessions also for any of our clinicians that are having a difficult time or just want to talk it out. The National Guard was here, says how many people we have currently that are COVID positive and the ones that are leaving, and all of this information that we want to arm the rest of our colleagues with as much information as we can give them, so that when they go to a donor that they know very well from their caseload, that they've had interactions with before, and they can say, listen, like my colleagues are our hospital is desperate for this, and this is why, and this is what they're doing. And along with all that data, we also have some wonderful communication, especially some videos. Our President Katsouleas, walked through the hospital with a mask on, thanking everybody from the janitors to surgeons to there was somebody fixing a light in the middle of the hallway of the ED, and he stopped to thank them. He toured our triage tent, and those are things that if you're not necessarily right in this area, outside of close to Farmington, or if you're not in the health sciences space, you might not know it's there. So we want to make sure that even those alumni that are across the country, that they know that they can be proud of what their university system and their hospital is doing.
Yeah, and two things I just want to reflect back that you mentioned that I think are really critical. And one is it's not just about a fund for UConn Health. It's like, these are our specific needs. This is, if you give today, this is exactly how we're going to be using that money. And I think whether you're asking for a major gift, or even as we think about restarting, annual fund support, or, donors who are at my level, that's critical. It has to be about something like seeing that immediate impact. But then
Absolutely.
like the visuals, like having, showing the president walking through the hospital, showing the workers, showing, what it looks like to be on the front lines. And, those visuals, whether it's video or photos, like tell the story. And
Right. It's really powerful. I think that, even though we're all going through this together and we watch the news or don't, however you monitor and filter your consumption of that, it can still feel like it's not necessarily happening to us. We're all in our homes, we're in our little bubble. So we had a parade on Wednesday. There were 5 different towns from that brought all of their law enforcement and the and everybody. And Jonathan, our husky dog, was there, 4-legged and 2-legged, and they did this beautiful parade all throughout the campus of the hospital. And so I put my kids in the car and we went to see, because we could stay in the car and be safe and watch. And about 50 clinicians came out, in their scrubs with their masks on, to watch and wave. And even my 10-year-old, she said, "Wow, this is really a big deal." And I think you really need to see that. And if you can't leave the safety of your house, we want to make sure that everybody has that information. So we're going to be sending it out weekly to our colleagues, and to all of our donors that have given to the COVID-19 fund, because we want them to know what's happening. Also, we want them to know that gift, no matter what it was, has been so impactful.
Awesome. No, I think that's a great effort, and I can't wait to see how the results go. Peter, you've been leading the team at UConn for a few years. You led the team at Yale. Previously you've been in the health center medical fundraising space for a while. What do frontline fundraisers, gift officers who haven't done medical fundraising need to know? What's your top 1 or 2 tips?
So I think sense of urgency around this. When I fundraised previously at Yale in cancer, there was so much research that could be done, projects that could be expanded with the infusion of philanthropy, that I felt pretty strongly that we should move quickly into a gift conversation rather than extend the cultivation that you might do elsewhere if you weren't in academic medicine or health sciences. I think, too, in this space, because COVID-19 is affecting so many people, understanding that the folks you're talking to, alumni, donors, community members, may have been impacted by this personally. We've had a member of our family who passed away recently, our extended family. So you don't know, right? You can't make assumptions. And that's one of the first things I learned when I entered medical fundraising was do not make assumptions about people who've experienced disease, medical trauma, sickness. Ask them what it was like, ask them how they're doing, and what you should know or what they would want to tell you about that. Good fundraising is active listening and thoughtful understanding of where a person is at, rather than just what you need in that particular moment. So you balance those 2 things, and demonstrate too through good stewardship that their philanthropy has had an impact. A pretty profound way, as you were alluding to earlier. People leaving the hospital healthy, who arrived in really tough shape.
Yeah, ask questions, active listening. I mean, especially if you're entering unfamiliar territory, if you've never done health sciences fundraising before, ask a lot of questions. Ask the experts, on your team, ask the donor where their interests lie, what their experience is, what their thoughts are. And this is one of the few times in advancement where you do have the ability to not have to manufacture like a time bound or nature or sense of urgency. Like, this is super urgent. You need RVs tonight. You need food to feed the healthcare workers today. Like, you need personal protective gear last week. So yeah, that makes
So
a lot
true.
of sense. Yeah. We've covered a lot of really good things, really helpful tips. Is there anything I haven't asked that you feel other teams should know during this COVID-19 pandemic?
And so I think one thing that I would add at the end is good development officers are good listeners, sensationalists. They own and control their space and information, and are benefited tremendously by good stories, good marketing, good communications, great information that's accurate, compelling, real, very personable and human. We're fortunate to have that. We've got a great team in marketing and communications at both the foundation and also at the hospital, and are all working together in a way that we have, excuse me, that we haven't in the past, but have come together pretty seamlessly. Again, as I alluded to earlier, I think we're going to emerge from this a much stronger development and communications shop than we may have been if none of this had happened.
Well, somebody on the marketing side, I love that marketing shout out. That's great. Natalie, any closing thoughts, anything to add?
I would say, similar to what I said in one of your posts on LinkedIn, when you had mentioned, someone had said to you to give yourself grace. And I think we all have to just start with that and remember that with whoever we're talking to, similar to what Peter said, that you can't just, you can't make any assumptions about who you're talking to, and just to make sure that you have all the information. And I think don't be afraid to be vulnerable and emotional in these moments. We talked a lot about that before the pandemic when we were getting ready for our Grateful Patient fundraising to really kick off that it's okay to feel emotion when you're talking to a donor or to a patient that, that is in the hospital or has, life altering event, and just take that into consideration. But also don't be afraid, because this is really immediate and necessary.